think it's time we rise up, people. It's time's up, people. You can talk all you want, but it won't change a thing. I wanna know what you do.
Hey everyone, and welcome to the Up and Up with Jodi Newell. I'm Jodi Newell. I'm here with Joe Nice today. As you know, we've been doing a series about the Medicare March for Medicare for All. All good things. And Joe is going to be speaking at the DC event. Joe, why don't you tell us a little bit about yourself?
Hi. First of all, Jodi, thanks for having me on, and thanks for the invite. I'm honored to be on your platform today, just talking all Medicare and anything else that comes up in conversation. I'm a world traveler. I've been to 48 countries. DJ, record label owner. Got 2 master's degrees from a couple of different universities. I've humanitarian. I guess some people have called me that. I've done a lot of different stuff in a lot of different places. I've got citizenship in 3 countries, and more important, I've worked with refugees. I've, done all sorts of stuff around the world, played a few shows, released a few records, but I'm mostly, I'm concerned about this whole healthcare thing because, that's really what I'm active most about in terms of my activism, because we live in a country where everyone doesn't have healthcare. We live in a country that is the richest country in the world based upon gross domestic product, and there's probably a third of the population does not have healthcare at this point, either uninsured or underinsured. So that's me in a nutshell. I'm a dad, got a 10-year-old daughter. I like my calisthenics in the morning when I wake up. I've been vegan for 12 and a half years. Yeah, that's really it. I've got, a little bit of a social media following here and there at Joe Nice DJ on all socials. So yeah, it's interesting being back in America also, because before the pandemic, I was living in Canada with my now ex-girlfriend. And it's interesting to see how being in the United States, just there's an additional weight that's placed on you. And it's not just financial in terms of taxes and the cost of living. It's just the stress of being an American. And I feel that the second the plane lands back in the United States, and I've been feeling that since March 22nd of last year, because that's when I came back to the United States. And it's just been strange being back in America for all this time, because I'm so used to not being in America for an extended period of time. But other than that, I'm good. I'm healthy. I'm reasonably content as much as I can be, and I'm looking forward to chatting with you for however long today. How are you?
Wow, Joe. I'm blown away because you just say those things like they're just like super casual things, like, oh yeah, I got a couple master's degrees and I've been to 48 countries. I'm happy that I've been to 48 states. That's like here, let alone other countries. My list is much smaller. Although
you got me beat on states. I've been to,
okay.
yeah. I'm at, my state count is 40, but then if you include DC, DC's not a state, but whatever. But not counting DC, I've been to 40 of the 50 states.
Okay.
You're at 48. Okay.
Well, I finished up my it's been all of the continental US states except for Alaska.
And Hawaii, obviously.
And then Hawaii. I haven't been to Hawaii yet, but yeah, one of these days it's
happening. I've been to Hawaii now 3 times, but I've never been to Alaska. But there's a bunch in the middle of the country that I've not been to.
Like, what's funny? I was supposed to go to Alaska last August, but of course it was August of 2020 when everything went to hell. And then, of course, so here I was supposed to get my Alaska in, and I didn't. I just brought it up to my kids the other day, and they're like, "No, we're not going to Alaska.
We're not going. We're not doing. Not now.
Yeah, right.
Not now. But you'll figure it out. You'll get there eventually.
Right. So I want to know, well, I guess, first of all, what I'm asking most people, right, about kind of, we're talking about Medicare for All.
Yes,
Or I guess what I want to clarify, because it would lead to the question that I want to ask, right?
sure.
Is, when you've been to 48 different countries, right?
Mhm.
And you've seen how the healthcare has worked in a lot of different places.
Yes.
Or I guess my initial question would be, what makes you so passionate about Medicare for All? But I feel like those things might be intertwined. Tell me if I'm wrong.
No, you're not wrong. You're absolutely right, Jodi. And I guess part of it is years ago, actually in both stops in graduate schools, both graduate schools, University of Baltimore and Wake Forest, I worked with refugees. And in many instances, the refugees I was working with were coming from countries that didn't have healthcare,
Hmm.
that didn't have a government managed healthcare system, or the only health care that they were receiving was when they were in the refugee camps and then receiving health care from either United Nations or the International Organization of Migration. So when they came to America, it, obviously the whole Medicare and Medicaid situation is a challenge because now you're having to fill out forms, you're having to go sit with people at different medical facilities, et cetera. The linguistic barriers obviously become a challenge because in many instances, these people aren't speaking English. They're not speaking English. English is not their first language, even though they might understand it. When you're in this clinical medical encounter and English is not the what's called the A language or mother tongue, you're not supposed to be conducting any sort of medical interventions with that secondary language. You're supposed to be using an interpreter at that point. And then there are some medical concepts that might get lost in translation, literally and figuratively. And and I saw in many instances when the benefits ran out for that specified period of time when refugees come into the United States, that many people are just left destitute and without health care. And in a lot of the other countries that I've been to, like Australia, Austria, New Zealand, Slovenia, France, Germany,
So jealous, but okay.
Switzerland, um, Netherlands, Sweden, Portugal, gosh, I'm trying to think, Canada, Belgium, they all have healthcare systems and they're all either single payer or universal healthcare system models or socialized care. And in the United States, we don't have that. And I've seen how in other countries where I've seen friends of mine have surgeries and go to the doctor and they're paying nothing. And I'm just like, yo, you just went to the doctor and didn't have a copay? They're like, yeah, we never have copays. And I'm like, what? Oh my gosh. Every time I have to go to the doctor, I have to pay for it. They're like, really, Joe? That's how it is in it? I'm like, yeah, it's how it is in America. And you have to have insurance. And you have to have insurance. And so my, again, we're the richest country in the world based upon gross domestic product. There's no reason why the United States should not have Medicare for all. We should have it. We should have it. And as I said months ago, when I was at the Force the Vote marches in Washington, D.C. on January 3 and 4 of this past year, I was interviewed by my good friend John Farina from Status Quo. He's a video journalist. Everybody knows John. And he was asked me to talk about why I was there. And I said that Medicare for all is actually healthcare or medical care is a human right as prescribed by Article 25 of the Universal Declaration of Human Rights. There are certain basic services, basic needs that human beings are supposed to have, like food, clothing, shelter, medical care. If you remember in grade school or middle school or high school or college, Maslow's hierarchy of needs, and those sort of basic level necessities that human beings are supposed to have, right. Food, clothing, shelter, medical care. So if a country like the United States is unable to provide its citizens with the most basic of services, like medical care, look at the housing crisis that we are currently dealing with, and that will get worse when this moratorium ends. That the United States, in my opinion, is a failed state. It is a failed state because, again, when you're not providing your citizens with the basic level services, like what you see in Articles 23 and 25 of the Universal Declaration of Human Rights, right. Or what you see on the bottom level of Maslow's hierarchy of needs, then this question must be asked: why in the hell are United States citizens actually paying taxes? What are we paying for? What are we paying for? Last count, I think 54 cents out of every dollar spent in the United States goes towards the United States military. What about some of that money, or actually, what about all of that money going towards social services and healthcare? What about that money going to a housing first program to make sure that people are not living under overpasses, underneath every bridge that you see in every major city in California? Mm-hmm. Why aren't we doing these things? Why don't we have a federal jobs program that is designed to rebuild the infrastructure of this country instead of destroying another country's infrastructure? There should be two major jobs programs right now. One just strictly just for infrastructure, and the other internet for all. There should be broadband access in every single part of this country. And again, just as we talked about this before we started to hit record on this interview, I played a festival in Northern California 2 weeks ago, and the nearest town was a 45-minute drive away. And where I was, not only was there was no internet access on this where I was, none, no Wi-Fi, no nothing. And fine, it is a campsite, and obviously you want to get away from technology. But there are people who live near that area, right, who are families, who aren't camping, who have kids and a husband and a wife, and maybe an in-law living there, and other people nearby who will need the internet to conduct any sort of business or to have any sort of educational opportunities in the future. Why in the world isn't there an internet for all plan right now? And why is the internet left in the hands of the 6 or 7 major corporate entities that control 90% of our communication and our media? Why isn't this a public utility like the power companies across the United States, or the telecommunications companies that we see across the United States, or what they used to be before Bill Clinton tore it apart with the Telecommunications Act, I think in 1996 or something. Forget the year, but that was a Bill Clinton thing. Right. So kind of, I know that I opined a bit more than I wanted to, but getting back to the whole Medicare situation, we should have healthcare in this country. Instead of overly funding the military, how about funding social services, including healthcare? There's one of my master's degrees is in nonprofit management from the University of Baltimore. Not to everybody that knows about the University of Baltimore, downtown Baltimore. And with nonprofits, and I remember saying this to one of my professors, and we had an interesting discussion after class. I said, nonprofits are essentially outsourced government agencies. And there is a bit of truth to that, because if you look at the rise of nonprofit organizations, there's an inverse relationship with the decline of government agencies, right, that provided services that these nonprofits have to provide now. So much of that came from when Reagan cut money from social services and put that into policing, and then Joe Biden, 1994 crime bill, 1988 crack bill, which was the anti-drug legislation. Right. So there was a lot of money that went to policing and the quote unquote war on drugs, when the real war was the fights for humanity, freedom, equality, and survival in these United States, but typically by poor white people, Black, brown, and indigenous people, and other people of color. So again, getting back to healthcare is something that everyone should have in this country. And when people say that healthcare is too expensive in the United States, or a single payer model is too expensive in the United States, in Canada, the cost of their single payer healthcare program per person is about $550. In the United States, it's about $2,500. And that's for people who have insurance. That's for people who have insurance. So in Canada, obviously Canada is significantly smaller than the United States in terms of population. California has a bigger population than Canada. But if a single payer plan can work in Canada and the cost per person is less, then why can't we have that in the United States with a GDP that is probably 8 or 9 times what Canada's GDP is, with a population that's about 8 or 9 times the population of Canada? The numbers should add up. It should make sense, but our politicians are bought and paid for by these healthcare organizations, the lobbyists, and it's a joke. And what we've seen during this pandemic is whatever you are, you've become more of. So if you are a compassionate person and a benevolent human being, then you've probably been pushed to do more of that because you've seen other people suffering. If you are a greedy bastard, then you've become more greedy. You've become more greedy. Take a look at the billionaire oligarchs and how much money they have made during this pandemic. An estimated $1.4 trillion of wealth have been added to their
And they
coffers.
act like they earned it. And they act like they earned it.
Yeah, that's a huge problem. I have a big problem with that. So again, there's been plenty of people who, before this pandemic, were living paycheck to paycheck. They're now probably living day to day.
Yeah.
There are plenty of people who their living situation was good for maybe 3 months out. Their housing situation might be good for the next week or two. So the real pandemic that's taking place, in addition to the biological crisis that's taking place in the United States as a result of COVID-19, we have a social crisis and an economic crisis, and surely a political crisis. And these need to be solved. And I think a great way to solve much of the financial crisis that we're in right now is having Medicare for All, because one of the largest reasons for filing bankruptcy is inability to pay medical bills. Why do we have medical bills in the richest country in the world?
Not only for people, but for small businesses. We talk about these PPP loans, and I think we all know where they actually went. I mean, the majority of it just went to organizations and businesses that didn't need it. So it's how do you define? And I actually have had this conversation. I mean, I've had this thought through much of what you've just said, is how do you define? Yes. So we talk about a failed state. How do you define a successful state? Like, the GDP. Okay, well, is that what we use to define what we are, if we are the wealthiest nation? How do we define wealth, right? How do we define success? And at the end of the day, how do we define what a small business is? And what's very interesting is that our understanding of what we think a small business is not the same way that it's defined as far as the PPP loans and those kind of things are concerned. So when we talk about Medicare for All, so people talk about having an employment crisis where they can't, get people to come into work. Well, there's a lot of other things that go along with that. But when you talk about small businesses, you have to understand how frustrating it must be for small businesses, more difficult for actual mom and pop small businesses to be able to provide medical insurance for the people who are working there. So not only the individual, I know that at my work, which is a nonprofit, a homeless shelter is, I pay a portion of it, and then my employer pays a portion of it. Well, that comes out of, what their budget, what they can afford to pay. And it also comes out of my pocket. So not only does it hurt me, but it hurts this nonprofit that's trying to do good things for people in the world. Right. So it takes money out of their coffers, and it takes money out of mine. The one thing I do want to push back on, because there's this framing that kind of goes along with everything. And it's an understandable framing, I think, in the way that we've been brought up and to understand exactly how things work. But as far as the federal budget is concerned, we don't have to actually cut back on those other things in order to do these things. The things that actually bring back money, the things that actually benefit people, and ultimately are the things that we want to spend money on. The military doesn't bring back money to people. It brings back money to military contractors, right? So that doesn't actually do anything good. If we do a federal jobs guarantee, that puts more money into people's pockets so that they can put more money into the local economy and these kind of things. And so, but at the end of the day, because America has a fiat currency, we don't necessarily have to tax in order to do that. But I understand kind of where that framing comes from. I just kind of wanted to highlight that.
And it makes perfect sense. And the other part is not only the fact that Medicare for All would just be good for human beings' health, but it would save an estimated $450 billion per year. The federal government's, the military budget is somewhere in the neighborhood of $780 billion.
Yeah. It goes up by like billions, it's like $50 billion every year.
Every year. So you can imagine estimated $450 billion per year in savings. And that's just the financial cost, money saved. There's also the emotional cost of not having to be stressed out from having to worry about how you're going to pay your bills. There's also that, there is a cost in that. It's just difficult to quantify, or almost impossible to quantify. But then there's the benefit of actually knowing that you're in sound mind, body, health, and spirit. And you don't have to worry about how you're going to pay for things that should be basic human rights. And what monetary value do you place on good health? What monetary value do you place on being able to get a kidney dialysis or your diabetes medicine or having that heart surgery, and you don't have to worry about how you're going to pay for it?
Yeah.
What there is or that knee or hip replacement. There is a feel good cost of knowing that you're not going to be stressed out when you leave the hospital in 3 days and have a $285,000 medical bill that you have to pay, and you have no idea how you're going to pay it, and you can't discharge it from bankruptcy. And the main reason why you can't discharge it from bankruptcy is none other than Joe Biden.
Well, here's the thing. No, now, did you hear about this thing that just came out? And it was talking about Amazon's the way that they're how do I want to put it? It's basically looking at their employees as if they're disposable. They don't expect people to be there for very long, right?
Sure.
So in that type of dynamic, when this is, and I think that that's a very capitalistic way of looking at it, right? Is like,
Right.
okay, well, it doesn't matter. These are human capital. And I think that's the expression that I heard at one point, human capital. And it doesn't matter as long as we have somebody to back that up, blah, blah, blah. And so when you're looking through that lens and you're seeing people as human capital, how on earth are you going to see the benefit of maintaining the well-being of a human being, right? So, but of course, then we look at the Constitution. It's supposed to be for, life, liberty, blah, blah, blah. It's supposed to maintain for the well-being of people. And so you would think that based on, what our country portends to want to accomplish, that they would be the ones who are maintaining this type of thing. What I think is that corporations have basically taken over the operations and the decisions and the regulations that go through Congress and things like that. And so that has been thrown completely out the window, if it ever existed in the first place. But I think I would like to think that that's a valuable goal, or a valuable.
I
firmly should be the goal.
It should be the goal. And these greedy healthcare organizations want their money. They want their money, and they don't want it discharged from bankruptcy and getting pennies on the dollar from a bankruptcy settlement. They don't want that. And I know in the United States, I think 500,000 or a little bit more than 500,000 families file for bankruptcy strictly on the basis of inability to pay for medical bills.
Yeah.
Think about that. So these healthcare organizations are getting their money one way or another. And if they file, and you can't discharge medical bills through bankruptcy. So the only thing you can get is, I guess, some sort of bankruptcy protection, which only lasts for a period of time before that ends. And then you have to figure out how you're going to pay these medical bills that you have no business being able to, you should have no business having in the first place,
right?
Let alone these medical costs being incredibly exorbitant. You look at some of these medical bills, it's like, okay, well, why am I paying $95 for 2 Tylenol? Why am I paying $47.50 for a tongue depressor? A tongue depressor is a popsicle stick minus the popsicle.
Seriously.
That's what it is. It's a popsicle stick minus the popsicle. And you're going to charge me almost $50 for a piece of wood. I say, really? That's what it is now? So, yeah, we need to completely overhaul this healthcare system of the United States. And if you allow me another minute or so, I don't think people truly understand how terrible the Affordable Care Act actually is and why it's a bad piece of legislation. And everyone thinks that Barack Obama, a Democrat, was the major driving force behind the writing of the Affordable Care Act, when he wasn't. He wasn't. He essentially passed Mitt Romney's healthcare plan on the state level, mass care, or pejorative.
Yeah, I'm from Massachusetts, so Romney Care, we had it first.
You had it. You had it.
Wasn't
and most
great.
People,
It wasn't great then. It's not great now, but okay, go ahead.
No, but and that was created by a right-wing think tank called the Heritage Foundation, where they based their healthcare model on what's called a 3-legged stool model of healthcare. The 3 legs of the stool being access to insurance, government subsidies, and a fancy rule called the individual mandate. So there's your healthcare plan. There's your healthcare plan. So if Mitt Romney had been elected president, was in 2012 or is it 2016?
I think it was 12.
12, or is it 2008?
Oh, maybe it was. I don't know.
I think it was 2008. So let's just say
Okay.
2008. So if Mitt Romney had become president instead of Barack Obama, could have guessed what healthcare plan we would have had? We would have had the exact same healthcare plan, but it wouldn't have been called Obamacare. It would have been called Romney Care. We would have had the same plan, regardless of if Obama had been elected president or Mitt Romney had been elected president. And what makes this healthcare plan so insidious is that fancy rule called the individual mandate.
Right.
And a lot of people don't really understand what the individual mandate actually is.
Hmm.
The individual mandate is a fancy rule that forced everybody to buy health insurance, or the Internal Revenue Service then assessed a penalty to you for not having health insurance.
Yeah.
The penalty for an individual was $695. The penalty for a family was $2,000. So let me take it out of the health insurance realm and give you a different example. What kind of phone do you have?
An iPhone.
You have an iPhone. So if the federal government said, Jodi, you are only allowed to have an Android phone, because I'm an Android phone user, and you, Jodi, have to buy an Android phone. And if you, Jodi, don't buy an Android phone from this private company, Apple, we, the public, are going to assess a penalty to you for not buying a privately owned product. If that happened with phones, people would be screaming bloody murder and using all sorts of foul language. What do you mean I have to buy a phone? And the government's going to assess the public is going to assess a penalty to me for buying a privately owned product.
Mm-hmm.
What I just explained to you is exactly what happened with everybody being forced to buy health insurance.
Mm-hmm.
But because health insurance is an intangible, people were just like, oh, okay, you know what? That sounds great. That sounds fine. I'll just go ahead and go along to get along, and I'll pay these $350 or $400 a month payments that really don't give me a whole lot of coverage. It's called the Affordable Care Act, but it's not affordable, nor does it actually care for people.
Define affordable.
It's not affordable. It's not affordable. So what happened when former President Trump passed the tax cuts, which was known as the Tax Cuts and Jobs Act of 2017.
Oh, what it wasn't job cuts. I remember that was being floated at one point.
Exactly. Cuts. We want cuts everywhere. We're gonna cut your taxes. We're gonna cut your hair. We're gonna cut your grass too if you'll let us. Good Lord. Oh, so yeah, that could happen. That could happen tonight. You never know. But with Trump passed the Tax Cuts and Jobs Act of 2017, what that did is it reduced the individual mandate penalty for individuals and families to $0.
Right.
So health insurance companies knew this was coming. So what they did is they increased their premiums by a lot. The main reason why is because young, healthy people were no longer being forced to buy health insurance.
Right.
So what happened is, so they had to balance out their greed somehow and get their cut of the cake and the pie and the ice cream at the same time, and get the cow where the milk that makes the ice cream. They had to get everything. So what they did is they increased the premiums for anybody that wanted to buy insurance, but then they really increased the premiums based upon actuarial science for those who are most likely to use health insurance, which are older people with chronic medical conditions. So if you're 56 and you have a kidney problem, your health insurance is even more unaffordable now than it was pre-Tax Cuts and Jobs Act of 2017. So now young, healthy people aren't paying into the system. Everyone that wants health insurance has to pay more to cover the young, healthy people that aren't being forced to pay into the system. And the reason insurance works is because you have a shared risk among the aggregate. So everybody pays in, and there might be some people that don't get any benefit of paying in. But for every person that doesn't get the benefit of paying in, there's somebody else that might get 2 or 3 or 4 times the benefit of their paying in. And that's also based upon actuarial science, because they might pay a higher premium based upon their physical characteristics and their previous health history. So the Tax Cuts and Jobs Act of 2017 was realistically Trump's way of repealing Obamacare. but he knew he couldn't do that through legislation because it would have been a nightmare trying to sue all of the states that accepted the Medicaid expansion. It would have just been a mess. So just cutting out one leg of the stool was an incredibly effective way to really, I wouldn't say decapitate because it's a legs, not a head thing, but to really hamstring the Affordable Care Act and the way it operates right now. So that's why you now have deductibles that are $5,000 or $7,500 or $12,000. And you have premiums that are more expensive and there's less coverage. So quite honestly, you would almost be better off making less than the minimum required, or less than the maximum amount required to still qualify under Medicaid. Because at that point, you don't have to pay anything for your health insurance. But the minute you get above that, and this is a phenomenon that happens in every state, there's a phenomenon called the coverage gap, where in every state in the United States, you have Medicaid, and then there's a gap between where you make too much money for Medicaid, but not enough to afford the Affordable Care Act subsidies. And that space between is the coverage gap. And every state in America has it. In some states, like where I am in North Carolina, that gap is huge. It's a big, big gap because they did not accept the Medicaid expansion and that block grant of money that went to healthcare, where states received 90 cents out of every dollar for medical care. So, and then the state I used to live in, Maryland, they accepted the Medicaid expansion. So that gap is smaller, but it's still a gap that quite honestly should never exist in the first place because we should have Medicare for all.
Yeah, absolutely. Actually, when we lived in California, we were in that, long story. We shouldn't have actually been in that gap. How do you define income? Well, if it's non-taxable, then it's not that. But anyway, exactly. And what they offered us, let me see, it was you would pay up to $1,000 a month for any expenses. This is per family, myself and my 2 children. And you would pay up to $1,000, and then anything beyond that they would pay. And I was like, that's very interesting because we have $0 taxable income right now. So I don't know how you expect me to. What
do you do with that?
Yeah.
What do you do with that? And again, with a single payer healthcare system or Medicare for all, you wouldn't have to worry about that.
Right.
None of these problems would exist.
I like how you're talking about Maslow's hierarchy of needs. I mean, I always come back to that. And I think that it's just a very basic thing. It's interesting, when I was in ninth grade, I don't know if at this point I had heard about Maslow's hierarchy of needs, but I remember writing in this paper that any country that cares about its citizens takes care of the basics. And what the basics are, to my mind in ninth grade or whatever, which is actually pretty congruent with how I feel right now, is taking care of, everybody has a roof over their head, food to eat, education, and healthcare. I mean, those are just the 4 basic things that, those are the things that you need to, to be a healthy human being, I mean, to start a
functioning citizen of a particular nation or state, right? And to go along with that, there are 4 institutions that every community should have: a bank, a grocery store, a school, and a hospital. And there are many communities across these United States that are lacking in one or more or all of those basic institutions that are the pillars of any functioning, thriving community.
Yeah.
And if, again, not to get too far off the topic, but if we had a government that actually took care of its people, then we would have postal banking. We wouldn't have banking that's controlled, that a for-profit banking system. We would either have postal banking or public banking. If we had a supply chain and we had more of a focus on local produce and locally grown vegetables, fruit, locally produced milk, cheese, etc., then we wouldn't have food deserts. We wouldn't have them. If we had an educational system that focused on not only reading and writing, but focused on developing our children into functional human beings, because a lot of what kids are learning in schools now it's totally useless. I don't care about the Mesozoic era of when dinosaurs roamed the earth. Nobody cares about that. But you know, when you're 19 or 20 years old, you're going to eventually have to figure out how to balance a checkbook. So financial literacy should be taught early in life. You shouldn't have to be an accounting major at a local university to figure out how to balance a checkbook. You know, conflict resolution should not be limited to just being a psychology or psychiatry major in undergrad or graduate school. That's something that should be taught when you're in kindergarten. You see what I'm saying? So even the subject matter or the pedagogies that we are being taught or were taught in schools and that we're seeing in our children's schools now, it doesn't necessarily need them to be functional humans or self-sufficient humans when they become 18, 21, 25, 30, or 40. You end up having to pay for services that really should be taught when you're young. You should know how to change a tire on your car. You know, you should know how to fix a hole in drywall. You should know how to cook your own food, or better yet, how to grow your own food. Wouldn't that be nice? But I also understand that there is a time and place for learning the quadratic formula, and there's a time and place for learning, you know, about 18th century British literature. I get it, and it's cool to learn all that stuff too. But in addition to learning all of that stuff, the stuff that we should be learning is just how to be basic functional human beings. And so much of that is not being taught in schools. And then the other basic institution that we should have is a hospital. And take a look at how many hospitals have closed. Take a look at the hospital situation in New York City, where Governor Andrew Cuomo closed a bunch of hospitals because he didn't collect enough tax revenue from the billionaire class that lives in his state. That then last year, he turned around and asked President Trump for ventilators and a mobile hospital in a boat, and then turned the Javits Center into a triage area. Well, if you had these other hospitals that could have remained open and you didn't close them and turn them into condos, then you would have enough hospital beds. So again, government is not doing enough for its people. And I think you and I are at least in agreement on this, that the United States is a failed state, and it continues to fail its citizens. And I have long been a proponent of not only the Yellow Vest movement in France, the Gilets jaunes, and this my friend Eric Kessner out of
nice. Love Eric.
Yeah, Eric's a good dude. He's a good brother. He made a bunch of these vests strictly for the Medicare for All marches. He was kind and benevolent enough to send me one, so I'm thankful for that. But even at every protest that I've been attending over the past couple of years, you've seen me wear a yellow vest, because and the yellow vest, depending on where you are, has a different context. But for the most part, if you see people with a yellow vest, it's a sign of being not only anti-establishment, but pro-worker. And I have long been a proponent, now more than ever, of mass worker strikes across this country, not only intra-industry and inter-industry. Let's not forget this, during this entire pandemic, the United States did not lock down like other countries in Europe did.
Right.
Germany locked down, France locked down, Spain locked down, Portugal locked down, where my dear cousin Jillian lives in Malta. They locked down, where a bunch of my friends in Bosnia and Croatia live, and Slovenia. They locked down. The United States, Canada locked down. The United States didn't lock down. There's a major reason why. The United States didn't lock down for fear of what a worker's stoppage would have done to the economy. If people didn't go to work for 2 weeks, what would that have done to the United States economy? So let's think a bit more ahead. Let's three-dimensional chess. Well, not even three-dimensional chess. Just move the pieces around so you can get check and then checkmate. What would have happened if every grocery store worker and every HVAC technician walked off the job in this country and said, I'm not coming back until our 538 members of Congress bend to the will of the people? What would have happened? Do you think in the CARES Act, we would have only gotten $600 a week plus whatever our state benefits were giving us? No, we would have had Medicare for all. We would have had some sort of health care that would have covered everybody at minimum through this pandemic. And we would have probably gotten more than $600 a week, which if you break it down by hour, by a 40-hour work week, is $15 an hour. The same $15 an hour that Joe Biden and Raphael Warnock and John Ossoff said they were going to fight for, but then never fought for. And same for the squad, all of them. The same $15 an hour.
Yeah.
But now we got $300 a week. So if you break that down by a 40-hour work week, that's $7.50 per hour. 25 cents more than the federal minimum wage. So right now, anybody that's still getting the $300 a week paycheck during this latest stimulus package or latest act is only getting 25 cents per hour more than what a federal minimum wage would pay. That's what $300 a week is. It's $7.50 per hour based on a 40-hour work week.
Yep.
But remember, we've got billionaires that are going to be launching themselves into space in the next couple of years.
Because that's awesome. And you know what? It's interesting though, because they are talking like that's the case. Like the way that when I don't watch TV very much anymore, but I don't watch TV at all. But I see clips every once in a while, and you know, the way that people are talking, it's as if everybody, you know, oh, everybody just got lazy and nobody wants to go. You know what I mean? This kind of thing. It's as if what you described, you know, that kind of wake up call is it's as if that happened, but that's not really what happened. You know what I mean? It's kind of interesting. Anyway, thank you so much for coming on. I got to wrap it up and all that.
Of
but
course.
I'm really excited. Actually, I get to meet you in DC in person.
Yeah, I'm going to be there. There's going to be a bunch of us
there.
There's going to be a bunch of us that are going to be there. Out to Savage Joy Marie for having me on. Out to Sharif. Out to Ricky. There's a load of magnificent speakers that are going to be on the bill. Lee Camp will be there. Paula Jean Swearigan will be there. Dr. Joe Jarvis will be there. Gosh, I'm trying to think who else is going to be there. Reverend Annie Chambers, who's an absolute powerhouse. She will be there.
I know Marianne Williamson will be there.
Yeah. Oh, and Marianne Williamson is the keynote speaker.
Yeah.
There's a few other activists that will also be involved. And somehow a DJ that's traveled around the world it somehow just made his way onto this distinguished list of speakers. And I'm honored. And I know. Who would that be? Who's that brother? But yeah, I'm honored that Savage Joy thought enough of me to put me on. I mean, she actually saw, I was standing 8 or 9 feet away from her at the Force to Vote rallies when she gave that, heartwarming talk about, why everybody should have healthcare. And then I saw her with the conference with Jimmy Dore did. And I mean, there wasn't a dry eye at that park on January 3rd and 4th. Everybody heard it and everybody felt it. Everybody felt those words. It was real, and it was a real conversation. And so, yeah, it's, this whole Medicare for All thing, it's not just for people like me who are reasonably healthy and, are okay. What about the Savage Joys of the world who have to have expensive injections that cost a ton of money per month? All right. What about the millions of people who lost their health insurance as a result of this pandemic, and it was employer-sponsored health insurance? And it's not just, I don't want people to understand this, when let's say you have one sole breadwinner or income earner in the house, and that person is responsible for the health insurance needs of a particular family. When these statistics come out and say that someone lost health insurance, they're not necessarily taking into account the spouse and the children that are also on that insurance policy. So if let's say that the wife is the main breadwinner and wife loses her job, well, guess what else? Husband and 3 kids just lost their health insurance too. That's 5 people. So it's not just a matter of these individuals lost their insurance. There are families that are involved with this. There are families that are involved that lost their health care. And when people say that we don't need socialized medicine, well, we actually already have socialized medicine in this country. It's called the VA. It's called the VA. We have it. We don't need a single payer healthcare system. Well, we already have it. It's called the current Medicare system. Oh, I got my vaccine for free. Oh, well, guess what? You know how that got taken care of? Medicare for All. So if they can give everybody a vaccine, if they can give veterans coverage, and my younger brother is retired Air Force, so he's on TRICARE, so he and his wife and his 3 kids get healthcare for the rest of their lives. If my mom and my dad and my stepmom and my stepdad can get healthcare through Medicare, then why can't everybody else?
Yep.
Why can't everybody else? It's Medicare for All. It's a human right. We're supposed to have it, and we're going to fight for it. That's what not January 24th, July 24th. Well, hell, we might have a march in January 24th of next year. This might be every 6 months we're in the streets. And it probably should be.
I know.
24th every 6 months, July, January. We get in the streets. If our politicians haven't listened to us, we find politicians that will. We find politicians that will. But even though I got the month wrong, the date is correct. July 24, there's marches across the country. Go ahead and visit all.org. If you want to sign up, hurry up, because we're adding more cities as we go along. If you want to buy some merchandise like this fancy t-shirt that says March for Medicare for All, and the website underneath. The yellow vest is exclusive. You can't get that on the website. That's exclusive to me and a few other folks.
Design your own. People can make their own.
Just design your own. Make your own. There's some creative cats out here that can paint and stencil. Or you could get a fist to get a nice little stencil that says #M4A now with an exclamation point in size 48 font. You can do that yourself with enough time and care. So again, Jodi, I'm so honored and I'm thankful that you thought enough of me to have me on your platform for all this time. And again, I want to make sure that everybody understands that Medicare is a human right. We got to fight for it. And this is not a matter of, I used to think that it was okay to just leverage the power to get what we want. It's not that anymore, because the politicians in Washington, D.C. are actively working against all of us who want healthcare. We now have to, as Public Enemy said back in 1989, we have to fight the power. We have to fight the powers that be. Mm-hmm. And that we have to think about that and behave in that manner now more than ever.
Yep, absolutely. I'm gonna just leave it with that. It's fucking amazing.
Sounds like a good way to do it. I'm good with that.
And I'll see you in DC. And I'll see you. I'm gonna see everybody in DC.
Everybody, come out. If you're in Baltimore, Northern Virginia, New Jersey, Harrisburg, PA, Western Maryland, Frostburg, Harpers Ferry, West Virginia, look, come out. We need boots. Boots are on the ground, and we need to shut shit down in this country. And the best way to shut shit down is the power of people. Again, you mentioned this earlier on, human capital. It used to be human resources, but then they went to human capital. I want people to understand that human beings are our greatest resource. We are our greatest resource. We are the power. And we have it in our hands, and we have it in our feet, and we have it in our bodies, and we got to use it. Use it or lose it.
Damn straight. All right. Thanks, Joe. And thanks, y'all, for watching. Like, share, and subscribe. And we'll see you in DC.
Yes, ma'am. Peace.